All right, what's up, everyone? Welcome back to Cuspide Insurance. My name is Carlos. Today we are continuing our series on all the health insurance companies, and we're doing a little review about each of them. You can check out the links up here. It's going to do a little pop-up. We've talked about a few so far. We're going to continue the series. Today, it's Aetna's turn, Aetna Health Plans. There's a little presentation we made here. So this will kind of let you know if Aetna is right for you or not. I still think it's one of the best companies, but so let's dive straight into it because there is a lot to talk about. Founded in 1853, and it was acquired by CVS Health in 2018. So under the Affordable Care Act, the official name for Aetna is Aetna CVS Health. Which is why it's because CVS Health acquired them, so they are together. And it joined the ACA back when it opened in 2014. And I say here it operates in all 50 states, but in the ACA, I think it's around 17 states or 20-ish. But it is not in all 50 states under the ACA, but they do have other health insurance plans like Medicaid and all that stuff in all 50 states. Over 39 million members nationwide, and the best news out of all of this is that they have one of the most affordable companies. They are one of the most affordable companies. They have many affordable health plans under the ACA, so that is great news because that's everyone's main goal. As far as plans offered by Aetna, it is a little tricky as well. Usually, 99% of the time, you will find in the only plans you will find for them under the Obamacare are HMO plans, health maintenance organizations. But they also offer through their own website EPOs, PPO, and POS plans. So I'm not going to really dive into the difference between all of these because I've made videos on it. You can check it out. I've made articles as well. But the main difference between the HMO is that it's the cheapest and it's also the most restricted, right? So you need a referral to see a specialist. You do not need a referral to see a specialist with an EPO, and then a PPO you can kind of go get care outside or inside of network. With an EPO and an HMO, you still need to be in the network to get care. So this is good because Aetna offers all of them for your different needs. And as far as the tiers go, each plan has tiers, and they have all four of them, which is bronze, silver, gold, and platinum tiers. And they also have catastrophic plans, but we're not really going to get into that as well. So as far as flexibility, they are a very flexible health insurance company because obviously they're one of the bigger names. So if you're trying to see this video because you kind of want to get coverage, just keep that in mind. What is covered by Aetna? So under the ACA law, all the health insurance companies must provide the 10 essential health benefits, which are emergency, hospitalizations, maternity/newborn care, mental health services, rehab, like physical or mental rehab, whatever, laboratory services, like taking out blood work, all that stuff, preventive and wellness services, outpatient care, prescription drugs, and pediatrics for the kids. So all of that you see on the screen is going to be covered. Usually people like to ask, oh, will it cover emergency? Will it cover surgeries? Yes, it's going to cover everything. But each plan is different. So depending on your budget and your needs on all that, it's going to be different suited for you. So that is the benefits to them or in general kind of that's offered by Aetna, but they do have their unique benefits. So one cool thing about them is that they have a free 24/7 virtual helpline with like a nurse hotline. Think of it like that. They also have same-day appointments through the CVS Minute Clinic, which is great that they're partnered with CVS. So they have a lot of, actually, as you can see on the screen, they have a lot of little benefits just through CVS. They also have Aetna Health app where you can do claims, you can find doctors, you can make your plan payments, you can find hospitals that you want to get checked out by, clinics, anything you can think of is going to be on that app, as well as you can make a member account and get all the benefits as well. So you will have access to a large network. Aetna is one of the biggest companies across the nation. There's some companies that are smaller, they're only in certain states, but Aetna is one of those names where it's almost a household name at this point in the health insurance industry. It's just giant up there along with Blue Cross and United Healthcare as terms of just giantness, right? They also have a rewards program for members, for those members who do enroll with Aetna. They have many rewards programs for things like preventive screening, all that. You get some rewards, cash rewards. And you have a $25 allowance every 3 months to buy a CVS product. So this is pretty cool. For those who find themselves at CVS a lot, this is a nice little bonus. Any CVS product you can think of, you get a nice little $25 allowance. Plus, you get a 20% discount usually on any CVS products, which is pretty cool for having a health insurance plan. Those are kind of cool benefits. Quick things I want to mention before we wrap things up here. Should you buy an Aetna plan? I think you should. If it happens to be in your area and it's the best suited for you, I think it's great. It's one of the cheapest health insurance companies. Now, I mean cheapest, but I don't mean that in a bad way, right? Cheapest doesn't always necessarily mean bad. I'm going to move myself here really quick. Cheapest doesn't always mean bad. They do have a lot of plans that are affordable, which is great, especially in 2024, 2025. Everything's just so expensive now. So there's a great addition to what's going on. So I genuinely do think that this is one of the better companies, in my opinion. I don't want to be biased or anything, but this is a top 5 throughout the whole nation. Just because, it's an established name. It's been here a long time. It has great plans. It has a lot of flexibility. And it's just a giant company with a giant network of doctors, hospitals. So should you buy an Aetna plan? My honest answer is yes. But if there's another better company that fits you better, then you should probably go with that one. All of these companies are good. There's not really one specific one better than the other. And again, if you want a free quote right here on the left here, 305-970-8583. Get in contact with us at Cuspide. We will help you find the most affordable plan. And that may be Aetna. So once again, 305-970-8583. I will see you in another video. Take care, everybody. Any questions, leave them below. Bye-bye.